As many of you already know, making sure our healthcare needs are met has never been more important. And since many of our viewers are Medicare beneficiaries, licensed insurance agent and spokesperson Andromeda DeBerry joins me today on behalf of MedicareAdvantage.com to help you better understand your Medicare options. Andromeda, thanks for joining me. Let me ask you a question. How can someone actually make sure they have the healthcare coverage they need before that next doctor's visit or that hospital visit?
Yes, well, thank you for having me. And that is a great question, Dr. Ian, because while Original Medicare does provide hospital and medical coverage, it has some shortcomings.
And everything has shortcomings, but what exactly are you talking about when you mention these shortcomings?
Sure. Well, for instance, with Original Medicare, there's no limit to how much you could potentially pay out of pocket for services.
Now, listen, that could be a real financial setback for a lot of people, especially we're in the middle of a pandemic. These times are very uncertain when it comes to economics.
Yeah, I agree. And Medicare Advantage plans can help with that.
So how can those plans help people that are already covered by Medicare?
Well, Medicare Advantage plans are an alternative to Original Medicare that may offer additional benefits like prescription drug, dental, and vision coverage at no additional cost. And plans may include coverages for items like eyeglasses, dentures, and hearing aids.
How many people actually take advantage of this?
Well, approximately 24 million people have enrolled in Medicare Advantage plans as of this year.
That's a lot of people. Now, some people are interested in things like vitamins, supplements, incontinence, even diabetic supplies. Are there allowances for those items?
Yes, and you may be able to get these items along with prescription medications shipped right to your home.
That's really important, especially now. Everyone's not comfortable leaving their home or they can't leave their home. So that's extremely important. And if there is a situation where people want to use telehealth services, what happens in that case?
Yeah, well, telehealth services like doctor's visits by telephone are included in all Medicare Advantage plans. There's also free wellness checkups, cancer screenings, and other preventive benefits.
And so if you, however, can leave and you're willing to leave your house to go to your medical appointments, but let's say, for example, you don't have transportation, you need a ride, then what can you do?
Well, in some instances, that may be provided at no additional cost.
Now, here's the question, Andromeda, everyone's been asking and wondering about. These all sound great, but how much will these additional benefits actually cost?
Well, that's another great question, Dr. Ian. And while this doesn't apply to all plans, 93% of beneficiaries have access to $0 monthly premium Medicare Advantage plans.
Well, I'm sure it's going to sound good to a lot of people. But let's say you're interested in changing your current plan because this sounds good to you. You want to see what it's like. What would they do next?
Well, the next step is to give us a call now. Most Medicare recipients can change plans only once per year, and that time is right now.
Okay, so if they want to do it, they got to get moving now. But there's some people who say, listen, I'm happy with my current coverage. Everything is good. What would you say to those people?
Well, I would say that every year, new plans and new benefits are added. So you should make sure you're getting the benefits that are available to you.
That's right. Things change and you may not know that they're changing. So if people want to look and see and investigate and explore, how would they do that?
Well, we've set up a special helpline just for your audience. They can call 800-460-6067 for a free, no obligation to enroll Medicare benefits review by a U.S.-based licensed insurance agent. Our agents can help you find the right plan for your health needs and budget. We can even search for plans that let you keep your current doctor.
Well, Andromeda, that's really important because people do want to keep their current doctor, but they also want to explore and see what other options may be out there. So these are great resources to help people navigate what can be sometimes a very tricky course. So sounds easy enough. I want to thank you for sharing this really important information with our viewers today.
Yes, thank you for having me.